Hi, Stuart.
Hi, Andy. Hi, Ariana. Hello, well, everyone so far. Yeah, thanks for getting here on time. I'm sure a few more people will be joining us.
Shall I try sharing my screen?
Yeah, I'll give you permission. I think as co-host you should be able to, but like let's give it a go.
Yep.
Yeah, so do you want to give it a go?
There we are.
Brilliant. Yeah, wonderful screens. Oh no, that's very good. Cool.
It's just a standard city. City template that I'm using.
Cool, works good. Hello, Elena. How's it going?
Hiya. It's going good.
Cool.
Done my teaching for today.
Oh,
now I can relax.
How did that go?
Okay, I think.
I don't know whether any of them will be in here, so we should be all right.
Good, yes.
Hi, James. Welcome. It's good to see you. We're going to get to a stage where I can't firstly greet everyone, I'm guessing.
Yes.
I've just admitted a couple of people, so...
Cool. So we'll probably give it like 5 minutes for people to fall in as usual.
Okay, that's fine.
Yeah, thanks a lot for giving your time today, Andy. I hope you're looking forward.
My pleasure. I hope people get something out of it.
Yeah, it should be fun.
This is an extended version of my vignette.
Oh, don't worry, I'll handle all the admin stuff.
Yeah.
Your vignette actually got quite a lot of questions, Andy.
I did, yes. It was, which is good actually.
Yeah, good to see so much engagement from the colleagues.
Yeah.
For those of us not in the know, what's a vignette?
It's a departmental seminar session that we have once a month. So we have like 3-minute vignettes from each research group. So basically like a very short talk about either, yourself or the research you do or research you have recently done or you're going to do. Basically making sure that we kind of making our colleagues aware of what's going on in the department while we are not looking.
So is this a COVID thing or is this always going on that I didn't know about? Hello, everyone that's joining us. We're just giving people like 5 minutes or so to check in before we start the actual talk. So we're just having a bit of a catch up.
Yeah, it's, it started during the COVID, but we didn't have a departmental seminar before. So we actually run it like, we have 1 month when we have 5 speakers from within the department. And then we have like next month, it's an external speaker invited from a specific research group. So by somebody within a specific research group. So last time we had somebody from an American university invited by Jason Dykes.
Cool.
As somebody within DataViz. This time I actually don't know who it is. I already forgot. I'm supposed to be on the team organizing it, but clearly I wasn't the one inviting the next speakers.
Fair enough. But unfortunately, externals can't get access to this thing.
Yeah.
Oh, well, if you see any good ones, let us know. We can sort of hijack them for our seminar series. Hi, everyone. We're giving it 5 minutes, another couple of minutes before we get started. Just give any latecomers time to join us. So it's good to see so many familiar faces. And I think, is it Tony that was part of this project joined us? He's joining us. Yeah, so welcome, Tony. So hopefully you can help Andy you know, with any questions and things. And hopefully you might be our seminar speaker next month, depending if your calendars and the stars align. Potentially.
Andy had a double feature this week, right? You presented on Tuesday. And
yes, yeah.
And
This
today
is
again.
a more detailed version of that, significantly more detailed.
That's good. Yeah.
So you're well prepared.
Yep.
Brilliant. So should we give it to 5 past and any latecomers can just catch up?
Yep.
Brilliant. Thanks for everyone that's joined us punctually. Hope everyone's week's been going well. Thank God it's Thursday.
Indeed.
Yeah. It'll soon be the weekend.
Yesterday I kept thinking it was Thursday because I was preparing something for Thursday, but for some reason I thought it was Thursday already, and then
It all blends into one at the moment, doesn't it?
very weird, because I was fully aware it was Wednesday, but you know that when you accommodate 2 different days in one in your head, crazy.
If you're doubly productive, that's even better.
Yeah, it was. Well, yeah, so it was very hard to do everything. I hope everyone is okay as well.
So we've got 1 more minute, then Andy will get started.
Excellent.
And if anyone has any questions and they don't want to shout, well, we'll save questions to the end. And then if you want to put them in the chat, I can read them to Andy, or you can put your mics on, but I'll let you know when it's time to do questions. I'm Stuart Scott. I manage the Interaction Lab at HCID. We're a UX consultancy. Some of you have worked with us and things. But yeah, if you want to sort of DM me your questions, or if you want to put them in the public chat, feel free, and I'll just read them out and be Andy's sidekick for this session. So I think it's probably about 5 past, Andy. Do you want to get cracking?
Yeah, surely. Okay, so welcome everybody. I'm going to talk to you today about search strategy formulation, particularly for systematic reviews, although I will briefly look at other areas. I just want to look at the various issues and challenges and perhaps some opportunities. Just a heads up, I'm very grateful to both Tony Russell Rose and Farhad Shokana, who've been very, very helpful in setting this. We're actually writing a paper, a review paper, at the moment. So so essentially, it's really this is based on the review paper we've written, but we're trying to review the literature and push the area forward. So, with no more ado, let's think about what I'm going to talk about today. So the first thing I want to do is just set the scene in terms of the professional research arena and talk about, give the context of what I'm trying to talk about here. And then we can actually focus on certain strategies for systematic reviews in healthcare, the essential issue that we want to address. And then I want to specifically focus on the current and dominant approach to doing this, to developing certain strategies in healthcare, which is systematic reviews, which is the Boolean, and then review some of the alternative approaches that have been suggested, and perhaps why they haven't, many of them haven't taken off. And from this, what I want to do is suggest a research agenda and a framework. To be honest with you, Tony Russell Rose mainly come up with, but I helped with the framing, which will help us, I think, address some of the, at least try to address some of the problems I'm going to identify. So in terms of certainly most people, when they're thinking about search, they're thinking about Googling. And for that sort of thing, you know, when you go to Google, getting the results is generally good enough. You know, if you want to go on a holiday, or, you know, you want to find information about who played bass for Led Zeppelin, you know, it's great. You know, you can find a Wikipedia page and get what you need. But this really isn't sufficient for many domains. Google is very precision focused, whereas other domains are very recall focused. They need to find as many relevant items as possible. So, for example, in law, a failure to identify case law could lead to a lost lawsuit. You absolutely have to find that case law. Patents, if you don't find a patent that is similar to yours, that's going to cost you a lot, potentially cost you or your organization a lot of money. In recruitment, you can't identify appropriate candidates. On the one we're particularly interested in, or what I'm going to focus on, you could potentially have a faulty clinical decision with life and death consequences, or healthcare policy, which could be a much broader issue. So the top results aren't sufficient. We need to be able to find all the relevant items. So this is what people traditionally see when this is a typical way that most people see searching, and it's not really what professional searchers do, and it's certainly it's not what people who work in producing systematic search strategies for systematic reviews in healthcare do. They do this, okay, and this essentially is a pretty complex way of doing things. They're using Boolean logic and associated Boolean logic, using truncation operators and proximity operators. It's obviously quite voluminous. These can go on for many pages, and they do tend to be. This isn't always the way that I'm giving you this big lump of text, impenetrable text, but they can be piecemeal. So, for example, in this next example is traditionally often what you will find. There'll be intermediate sets. So this is something called the line-by-line approach. So they'll grab individual terms and then put them together with OR, and you'll notice there's some truncation operators there with a $sign, which essentially is a implicit OR. And they also have the W there. I don't know what TW is, I can't remember, but it's a field operator. So these, as you can see, this is very different to what the general searchers do. It is complex. It takes a lot of knowledge to do. So let's now look at specifically search strategies for systematic reviews in healthcare. So I just want to think about why this is important, why we need to think about it. So essentially, the reviews, these systematic reviews, are used to identify the evidence that we need to support either a given clinical decision, which is, what is the best way to operate on a splenic hernia, for example, something I know intimately about, just having one, or it could be something in terms of social policy. What is the best way to react to the COVID-19 pandemic? And I think everybody can relate that. So there are different ways these systematic reviews are used, or they're used for different reasons. And there's quite a complex process that is used, and I'm going to focus on essentially the essential parts of it. So generally what you have is you have a development and approval of a protocol. It's peer reviewed, and that will very often have a specific research question. For example, what is the best way to do surgery on Spigelian hernias? And then there'll be a development of the focus of development of the search strategy, which is very much focus of what I'm going to talk about now. And then you have a quite a lengthy process of study screening to find what is the relevant literature for the systematic reviews. And then there'll be a whole a body of evidence, a whole workload, evidence synthesis, extracting information from the relevant studies in order to inform the systematic review, and then it's written and then published and what have you. But so I'm giving a very, very simplified version of that. So I'm going to focus largely on the search strategy, largely because it's firstly, it's a critical point in identifying the literature. It's a bit like in the software development life cycle. Getting things wrong in the requirement stage can have significant effects further down the pipeline. And the same is true for the strategy. If you don't get strategy right, then that has potentially a huge impact on the final evidence synthesis, simply because you haven't identified the right or correct or sufficient information to inform that systematic review. It's very, very time consuming and costly. A full review takes on average 67 weeks. So getting it wrong can also be costly. If you realize you've made a mistake, you've got to go right back to the beginning again. You've missed something. That can be very, very costly. So who are the benefits? Well, firstly, it's the health librarians by and large who construct these search strategies, stand from benefiting from better techniques, or we hope. This is what I'm going to talk about later. And obviously clinicians can make better decisions. If they've got a good systematic review, they can say, okay, I've got a list. I've got for a particular type of Spigelian hernia. I know now which type of surgery I can use in order to make a better outcome for a particular patient. And policymakers, given on evidence from pandemic management, they can recommend better social healthcare policies. And of course, us as well. We benefit as well from the better decisions, clinical and policy decisions. So the Boolean approach dominates, and there's a general process which is used to do this. And again, it's quite simplified, but generally speaking, what you have is they use some scheme, which and PICO is used a lot, which stands for population, intervention, comparison, if there is one, and outcome. And there are variations of that as well. So you're going to use that particular scheme for your particular problem. And generally what you do is you identify the concepts which represent the facets, which tend to be the search blocks. And within those search blocks, those facets, you'll identify the terms and the vocabulary. So you'll be looking at the domain that you're particularly interested in, but also any controlled vocabulary that you can rely on, to taxonomy, ontology, whatever it is that you can use. And once you've done that, as I showed earlier with line by line approach, you can then combine the facets and terms to create an initial search. You review the results, reform the strategy, you share the results with the team, go through yet a further process of reforming the strategy. And once that's finalized, then you execute it. you translate it to different databases invariably, because the information will be cast wide across different resources. And then you obviously will do the strategy, but the key thing the health librarian, whoever it is, will be reporting and documenting the search strategy. Hopefully, while they're doing it, making sure that the decisions are well documented, and that anybody who wants to repeat the search strategy can do so later. So, looking at this example I gave earlier, this real emergency medicine topic, there are a number of issues with this. Firstly, to do with structure. It's very, very hard to look at this massive text and see the structure from it. It's therefore very difficult to scale it. You just get a bigger block of text, and it's really, really difficult to see, just to interpret it. This leads on to errors. There's evidence from a couple of studies. One found that they looked at, I think it was about 90 odd systematic reviews. They examined it in these systematic review search strategies and found 90% had errors, 80% had at least one error, which inhibited the ability for the strategy to find relevant studies. The other big issue is heterogeneity. Because you're dealing with information that is spread lots of resources, there is no standard query language, so you've got to be able to translate that search strategy across different kinds of query languages. And this causes a problem with reproducibility that I'll talk about later. And the other big thing is the learning curve. It really is a significant learning curve. It takes. I'm very, very familiar with early stage professional searchers. I've been teaching a module on for 20 years, and getting used to it initially is in itself is a hurdle, but then you go into the field and it takes quite a few years to build up the necessary tacit knowledge to be able to do this with great effectiveness. So can we do better? Okay, so alternative approaches have been suggested, and I'll go through some of them. So there's been quite a bit of interest in terms of data and text extraction to identify terms using, for example, the PICO framework. Again, that does tend to rely on machine learning, which again, in terms is not always explainable, and explainability is important, something I'll talk about later. Automating query expansion, for example, decision support systems with PICO. An old colleague of ours in the centre, Dimno Sullivan, has been working in that area. Tool automation. This is, I have to say, this area is ripe for developing automated, automating the query development process. But again, for all sorts of reasons, it's not really taken off. The acceptance and trust with to do with the workflow has proved to be a significant barrier. There are other, the data modeling area, there are other logics out there, for example, fuzzy logic. They've not really taken off, and related to that is obviously ranking theory, learning to rank. Again, you can actually, most systems do a hybrid scheme where they do relevance and You can choose by sort by relevance, but you're still entering the Boolean query, but it's not in itself replace the Boolean mechanism. And then there's visual approaches. I'll come on to that in a moment, some of about how that might address some of the issues. But in general, for the most part, they've not really gained much headway, simply because they don't integrate into the workflow. There's a specific workflow that you have to adhere to because of the transparency issue. They lack explainability. A lot of AI techniques are used, natural language processing to identify terms, are using things like BERT, which is very successful in its own right, but there's there's a lack of explainability. You're losing control of the ability to to actually control the process of developing the search strategy. So you're moving, with a lot of these systems, you're moving the control away back down into the system, which inhibits transparency. So in general, there's a distinct lack of trust in a lot of these new ideas. But there is, there are movements, and I think one of the things that I'd like to point out is this visual approach, which Tony Russell-Rose and colleagues have been working on. I think, what I talked about earlier in terms of structure, this is the emergency medicine topic that I fed into 2D search, and this is the output from it. Now, it's still very complex, but at least you've got a chance to actually see the structure and work with it accordingly, and you can see what the facets might be. You've got more of a chance to actually understand what and share it with others as well. Giving one big lump of text to try and, okay, I've got to try and reproduce this and translate it to another database. You've got more of a chance here. It's much more scalable. You can see the terms and their relationships much easier. It's probably more, although there's no real evidence for this, it's something that I think needs to be worked on. It'd probably be much easier in terms of, firstly, avoiding the errors in the first place, but it gives you the opportunity. It does have an error feedback. If you make a mistake, it will say, no, you've done this wrong. So, there's definitely it's definitely it's a very, very good attempt to deal with that. It's also a good attempt to deal with the heterogeneity, in the sense that it's what you do is you enter in your query, and what it will do as best it can will translate it to the resource. And I think there's about 10 or 11 resources now that are available to you. And also, with the learning curve isn't so steep. Okay, you do have to know about Boolean logic, but it does give you an idea of how everything fit together in terms of the facets and the terms contained within those facets. So this is, I think for me, this is definitely the way forward. A bit of way to go yet, a lot of things that we need to address, but this is a very, very good start indeed. So what I want to do now is now think about a research agenda and a framework with which we can tackle some of these issues. So one of the big things that we need to consider is the control. So the people who in professional research generally, and in healthcare settings specifically, they do require control. They're very, very used to being able to, over the years, they've developed this tacit knowledge where they're extremely active searchers. I can't stress to you how amazing they are in doing this work, and the knowledge that they have. So they still need to be able to express their information need with maximum fidelity. Okay, it's very recall focused, and we must be able to support that. we must be able to support reproducibility and replicability, excuse me. So because these systematic reviews will need to be updated, so living reviews that require constant update, but also generally with many systematic reviews, medical science doesn't stand still, and it will have to be updated with new knowledge. So being able to reproduce easily and quickly and having a scheme to do that is something that we really do need to think about. And the transparency, the interpretability of the search strategy will help in terms of this, reproducibility. So being able to interpret it will allow you much more control over what you're doing, but also much easier be able to reproduce it. And trust, but being able to do this will give trust, and it must fit in particular, and the literature says this very, very strongly, it must fit within the systematic review production workflow. They are transparent, they do print, they do publish their search strategy, and it does go through a peer review process, so trust is extremely important. But there is an explainability issue here. So at the moment, we have a situation where the representation of the information need is the way you articulate it, okay? So it is explainable to some extent, but we still, we still have problems, we still have errors. So we can do better, and I think the 2D search way of doing things still gives you that ability to articulate your information lead, but still allows you to represent that information. So there's a gap here, and we need to be able to address this gap. We've started on it, but we're not quite there yet. So we have this framework, which, as I said earlier, really was mostly Tony's work, but I helped in framing. And the idea really is to think about 5 main things. Firstly, this idea of the transparent mapping between the logical and physical structure, so that massive text, all you see is this physical structure, and what we're trying to do is with a 2D search is to map, and it's a much better mapping, I think, in a 2D search, the visual approach, than there is, and that enabled trust and explainability to we hope, and scalability in formulas to accommodate the complexity. The Boolean, the raw Boolean queries I showed you are incredibly complex, and it's very, very, as we saw here with a line-by-line approach, it's very, very procedural. We want to move more towards the 2D approach, which is more declarative. Low-level operators are delegated to system functions. Now, TDO search doesn't really deal with that at the moment. You still have to know about the Boolean operators, and this is to deal with the errors. And being able to do that will in a way that allows users to articulate what they need, but also avoiding the errors. Still, keeping control is a big issue. Real-time development on query effectiveness. So being able to go through iterations quite quickly would speed up the process of developing the search strategy. Another big area that I didn't mention that is an issue is research waste. So being able to reduce the time for research strategy and developing much more effective research search strategies quicker is something that can be addressed by this issue. And then actually facilitate sharing, versioning and peer review is a big issue. This big lump of text mainly is how it's done, but having a scheme or mechanism by which we can easily share things will provide a much better mechanism for reproducing search strategies and deal to some extent with the reproducibility problem. Okay, so that's really all I wanted to talk about today, and I've left quite a bit of time for hopefully for questions. So over to the audience.
Well, firstly, thanks a lot, Andy. That was brilliant. It's really nice to see search sort of broken apart like that, and the sort of visual search towards the end was really engaging, just to sort of see a new way of doing it. We had a couple of questions in the chat that from Rene and Ole. So Rene's question was, what is defined as a search strategy, the Boolean syntax, or both the Boolean syntax and the choice of databases and sources of information?
The latter. It's very much the latter. Largely because the syntax across the choice of data, your databases or resources is different. For example, PubMed it doesn't even have phrases. It has a list of phrases that you can enter, and if it's not there, then it'll tell you. Whereas Dialog Procast actually provides you quite a sophisticated functionality in terms of asymmetric and symmetric proximity operators. I don't know if that answers your question, Rene.
It does.
Okay, that's good.
And we had one more question in the chat already. If anyone's got any more questions, feel free to line them up. So
okay, so right, so the emergency. Okay, so yes, I can share I can share that. It's by I can't remember the name of the paper now. It's Sampson and I'll have to look that up. Bear that with me. If you send me a message, sorry, I'll share my screen again. I accidentally bombed myself out. Where are we? So it's this one here. It's that one there. Yeah, it's Sampson and McGowan, I think. Yes, Sampson and McGowan. And was it part of the? Yeah. So that's. I'll try and do that for Ole. Ole, if I forget, then email me and I'll email you the reference. Renegade. It was part of the study leading up to the press checklist for. Yes, it's searched by it was Margaret Sampson. That is correct. On the press checklist, yeah. So that's a statement guideline, and okay, that's from. It's well after midnight. Okay, MSc and okay. Question from Ernesto. MSc student asked to describe the search strategy in the projects. These projects are not systematic reviews. We want to encourage systematic search. What would be your advice to generate? Okay, so what I would do actually is I would recommend 2D search. Have a look at 2D search. Give them an idea of how to do a bit of facet and how to do a facet analysis. So that's what I would recommend.
Is 2D search like where can people access that? Is that something that then ties
search for 2D search? Okay. I don't know if Tony is still here. Are you there, Tony?
I am, Andy. Hi. I'm on an iPad, so I'm not sure how this is coming out.
But it's coming out fine. Yes. Yeah.
Okay. Yeah. Shall I answer the questioner's query? Yeah, it's just freely available. If you go to 2dsearch.com, It's a web app and it's freely available. If you want to save your work or share your work, you'll need to log in or register to create an account. But other than that, it's completely free to use. So yeah, it is actually proving reasonably popular with students at the moment for exactly the reasons that Andy said.
Yeah, and Ernesto's found it and stuck it in the chat. Thanks Ernesto. Okay, so one from Martin. With increasing processing power, there's an interest in using dot-to-dot retrieval, the query engine, using the entire document as a source of search terms. Is this an approach on the agenda for systematic review community? I do. I'm not completely au fait, I have to say, with the screening process, because what tends to happen is I think there is a little bit of work in natural language processing and using models such as BERT to extract entity and their relationships. I know there is a specific BERT. I think it's biomedical model. I'm not sure exactly what it was.
It's BioBERT.
Sorry?
BioBERT.
Yeah, I think that's it. Yes. Yeah, BioBERT. I think so. There is interest in that, but I can't give much more information on it because I'm not really au fait with that part. I've really been focused on the search strategy aspect of it. So there's 7 new messages. A perceived trust in the Boolean logic versus a more probabilistic approach warranted. I've got a lot more to this question, but I'll need a lot of text there. Well, fair enough. I have a few questions. Yeah, go on, Stefan. I'll ask your questions, Stefan.
Well, I'm happy for you to cover them in order if you like, and then I'll slot in afterwards.
Okay. If you need more on the dot-to-dot, etc., let me know, and I can say something more about that. So, Rennie, do you want to say about more of the dot-to-dot stuff, and then we'll come to Stefan?
Yeah, so let me introduce myself first, because otherwise it might seem strange. My name is René Spijker. I work with Cochrane. I'm also part of the international collaboration on the automation of systematic review. So I've got a bit of a oversight on what's happening on the automation within systematic reviews. And it's not taking off as much as we would have hoped or liked so far, but there's a lot of research being done both on the, let's say, classical machine learning, where you use bag of words strategies and classification systems to use in the screening process, and more importantly, continuous active learning kind of modules based on the Waterloo University model. And people are now looking into the more kind of BERT, BioBERT, SkyBERT kind of representational ones. To be quite fair, most of that work has been done in the last 12 months, because there's a lot of been done through the Allen Institute on the COVID-19 kind of papers, where a lot of emphasis has been put on, can we speed this process up? But from what we've seen in the past is that the classical bag of words and even the most simplified classification systems, so like logistic regression, performed even better than support vector machines and BioBERT kind of based systems. Because the BioBERT systems quite overdid some overfitting, quite a lot of overfitting. So keeping it as simple as possible seemed to give the most optimal results. And this is also leading up a little bit to the question that I asked earlier about perceived trust that we have in the Boolean search versus the more probabilistic kind of work that's been going on. Because on face value, we are very much in favor of trusting all the words that we put into a Boolean search, and then saying, wow, this looks really trustful. We trust this is a good strategy. And we'll take that on face value as being our search strategy to base our systematic review upon. But we find it very difficult if we have to make a decision in a probabilistic kind of way for, okay, this is the boundary, and below this we're not going to screen anymore, because below this it's going to be not very informative to us. So I'm always very interested into why we trust our Boolean searches so much. So if anyone has any idea about that, because they're not a very true representation of the full text, so there's some things in between which I would love to hear some more thoughts about. I hope this helps a bit,
guess,
but
yeah. I mean, in my opinion, it's because it's been used for many years. I mean, the module I teach has been taught at City University for information science students for at least 50 years, and we've been teaching Boolean logic for as long as that. So a lot of the material, well, some of it, you know, at least with Boolean logic, goes back a long way. So it's pretty embedded in the community. And you know, I have to say, I think there are two issues here. One is the people who do the searching are so used to it now; it's sort of ubiquitous. And secondly, I think there is an issue here with regard to the database vendors, in that you know, there is no real for various commercial reasons, there's no real reason for them to change it, particularly when there's such demand. I mean, there was a bit when Dialogue was thinking about, for example, getting rid of its command line interface and removing its Boolean logic. There was uproar in the professional search community. So I think that you know, those are two of the reasons why that's the case. So there's okay. Yes, Ola, you did find the reference. That is the correct one. Chiara, hopefully an easy question. Does 2D search support lens.org? Tony, does it support lens.org? I can't remember.
Yeah, hi, Andy and Kira. Yes, it does, along with 9 other databases natively, and another 7 through automated translations.
Yep. Okay, so I don't think there are any other questions. Stefan,
yeah.
Fire away to with your questions.
Okay, so I guess I'm a search strategy novice, despite being interested in information seeking, and so I'm often looking at these things from a kind of user human information interaction kind of perspective, and I find it really perplexing that that it sounds like there are challenges into getting people to who do these systematic reviews to move towards systems that actually could be potentially much more useful to them. And I think Renee made an interesting point there about kind of speeding things up. And I think that there's definitely the potential to be able to sell these kind of more usable systems, like the visual search approaches that that we see from yourself and Tony, as being more usable, but also hopefully being something that that speeds up the systematic review process, and so therefore is saving knowledge worker time. So really, that's a comment rather than a question.
Yeah, and be more effective as well.
Yeah, and more effective at the same time. What I'm wondering also is, have there been many user studies that have focused on the people who are producing the systematic reviews and the terrible problems they must have in producing these kind of things? Because this screen that you've got up at the moment is not only symptomatic of a really complex search, but a search where there can be lots of errors. And from the little I know about systematic search, I think you can review a bunch of these kind of audit trails almost and find a bunch of errors in them, which might cause you to not place as much weight on the systematic review themselves. So in some respects, the overburdening of Boolean in these things actually means that it can make it more difficult to scrutinize, but also when you dig a bit deeper, it can make it more error prone. So in that respect, not just more effective, but also kind of fewer errors, perhaps. But I guess the question is then about user studies. So it's about have many people sat with people that create systematic reviews and observed kind of where they have difficulties, where we could be improving things for them, and in particular, I'd imagine some of this is done collaboratively. So is it the case that people have tried to observe how people work together to create the systematic reviews?
I am aware of at least one study which was presented at Glasgow in 2019, which was of that type. But I have to say there hasn't been, in information, the IIR, the information and interactive information retrieval type studies that we're used to thinking about, for example, at the CHEER conference, and I've certainly not seen anything generally in the HCI community. I mean, there has been a little bit about, I think the Sampson and McGowan, which has been posted. I mean, that is sort of a user study in the sense what it does is it looks at the output, the production rather than the process. I think it's a big area that needs to be done, and in particular, it's my view that we need to have a better understanding of the workflow in much the same way as that. Stefan and I have been working on a project called D-Miner, which essentially is looking at building tools to assist journalists to verify information. And one of the big things that's really come up is being able to fit any tools within the workflow in much the same way as this. So many of the same sort of things come up with regard to transparency and control and things like that. So I think we need to be able to do that in what we've done with, and I think we've done a fantastic job, or the people who did that, you and Maricela did a great job on doing the user study for D-Miner. I think we've also got to do this and reach out to the community and provide a much better overview of how the process works in terms of workflow, so that we can better. I mean, there are particular issues with this new technology that Rennie talked about with classification. We need to hold in, but those still we still have to find a way for those technologies to fit in within the workflow as a whole.
Yeah, so I think that lends to user studies that aim to understand workflow, and also user studies of the type of 2D search, visual systematic search type tools, and how they fit, but situated studies that aren't just focusing on the usability of those tools. And then just latching onto some of the words you've used recently, and they were themes that you used earlier in the presentation of trust and control and credibility and stuff like that. I've got it's just a reflection that I think that those are the types of things that people have been looking at when they've been looking at AI explainability, and I think that's no coincidence, because I think we're still talking about almost algorithms that are not transparent by default, and trying to make them more so. So it feels like we might have some synergy there, and that then leads me to think we might have a lot that we can learn from the people looking at AI transparency, explainability, etc. Yes.
I mean, I have to say, the paper that I talked about earlier. There's the framework, which I'll just buzz to, if I can just move the slide. So this framework was presented at a workshop at SIG-IR on basically focused on explainability and information retrieval, which is a burgeoning area. So I think we're very much in the IR community, we're sort of late to the game, but we are getting there. So yes, you're right, it is a big issue, and we do, you know, in the terms of work that Simone does, Simone Stumpf, one of our colleagues, you know, we have a lot to learn from that community, I think, you know, as with regard to what we're trying to do here.
Thanks, Andy.
So,
any more questions? Oh, Hind has said something.
right. So, okay. So, do you think it? Do you believe it can be useful for a novice in visual search? Can you please get us a reference to get it started? Okay. So. I think over to Tony really, because there are various. I mean, what I would recommend you do is click on the 2D search link that Ernesto provided earlier. Tony can provide you with the literature that he, together with colleagues, that he has done. It's, you know, it's based on a lot. There's been quite a bit of work on visual search over the years, including the use of things like tiles and Venn diagrams that he's reviewed. So if you could get hold of that, ask Tony for that literature, then I think that would help you. But actually using it, I think I think it's very easy to use. Certainly, I know I've got at least one student from my IR module who's I've already introduced to Boolean search, and next week I'm going to introduce them to 2D search and get them to think about the contrast between the different ways of undertaking search. So anyway, so it's a long answer to your question, but my belief, you know, it can be useful for a novice visual. You know, I think vis search is a good way to start on this.
Brilliant. Does anyone have any closing questions for Andy? I mean, thanks a lot for everyone that's joined us today and stuck around to the end.
Well, thank you from me, particularly for Renee, Ole, and also Stefan, for allowing such an engaging question and answering session.
Brilliant. And if anyone wants to connect with Andy afterwards, feel free. I mean,
please do. Yes, I'm very happy to talk to anybody and to. Okay, we often start with 2D search when we help researchers in our orgs and develop search strategy. Great tool. It's great to know. Thank you, Ole.
Can I just hijack this for a second, Andy? I'm explicitly hijacking it. If anyone's working for a charity and looking for remote user testing, we're currently looking for an opportunity for our students to get involved in that. This will be as part of an academic module. So if that's of an interest to you, contact me. I'll put my email address in the chat and we can follow up on that. But yeah, I'll let you get back to closing, Andy. Sorry about that.
That's all right. No, well, thank you very much. And hopefully I shall hear from you. We'll see you at some stage in the future.
Great, and see you all next month. Hopefully, have a great weekend.
Yeah, thanks for coming. By the way, Catherine, an old student of mine. Nice to see you. Great.
Cool. We'll let people round out. Bye, everyone.
Okay. Bye.